Hello guys, welcome to another day of our Women's Wellness Challenge. My name is David and this is
Dr. Feyi. How are you, everyone? Good to see you. Welcome to another day of our education.
So if you've been following us, we've been discussing different topics on women's health and wellness. And today we just want to talk about our topic today, which is thyroid. So our first question is, what is thyroid?
Thyroid is one of the organs that helps with energy. So on these sessions, we promise not to use too much medical terminologies so that everybody can benefit from the session. So that's why we're going to break it down and just use regular, normal words as much as possible. So thyroid helps with energy, and it's among the endocrine system in the body. It's located at the base of the neck. It's like butterfly shaped, and it's right there at the base of the neck. That's where the thyroid is.
So what does your thyroid do?
It produces hormones that helps with energy manufacturing and conversion. It contributes to that.
So what are some problems that you could possibly experience with your thyroid?
It could be sluggish and slow, which is called hypo, when the thyroid is not producing enough thyroid hormone. And it could also be hyperthyroidism, which is when the thyroid is doing too much, producing too much thyroid hormone. So when it's doing too low, or the opposite, too much. It can also be autoimmune disorder. That could also be a problem of the thyroid. It could be hereditary also. Could be from pregnancy to the baby, like that.
So how would you, if a new person would come into the clinic, first of all, could you share more about what you do, who you are?
Oh, yeah, sure. I'm Dr. Feyi. I've been in the medical field for 30 years. As a nurse, I'm from Nigeria, and I went on and did my family nurse practitioner 5 years ago, and then I wasn't getting the results that I wanted because when I write prescriptions for my patients, as we were taught in school, they gave us like formulas or protocols. When somebody comes to me with high blood pressure, after they've been diagnosed, based on their color or race, we have to start them on certain medications that has been proven to work best. But I found out they were still having high blood pressure after 2 years. And if they had problems with bacteria in their urinary tract or in their reproductive tract, they were still coming back. And I found out they already had those codes, such as recurrent UTI, recurrent BB. That means they knew they were going to come back anyways. And if my patients had fibroid and they were bleeding, I would give them something to decrease the bleeding, and then I'll move them forward to a surgeon that will remove the fibroid. So they were asking me, do you need any holistic doctor? My friend took care of her surgery of a fibroid, without medication. My friend had fibroid, she didn't do surgery. Do you know any holistic doctor? My friend had UTI, she didn't take a macrobid. My friend is using a holistic. I'm like, what is holistic? So I went into functional medicine. Meanwhile, I already said, after my doctor that I was not going to read any more book in my life again. But because of you, I paid it forward and I went on and studied functional medicine again, where we find root causes of diseases and reverse them with botanicals. So we just don't put band-aids on the problem. We just don't, treat the symptoms. But we find the root cause and treat the root cause. So if you have your tap water running and your kitchen floor is flooded, but you're mopping the floor, but you didn't turn off the tap, that is Western medicine. The cause of the problem is still there, but we're taking medicine. So in functional medicine, we actually look around and say, oh, this is a faucet that is running, and we turn it off while we're mopping the flood. So that's what we do here at Lifeguide. We also do medical weight loss, we do IV hydration, and we do IV hydration, primary care also. Okay? Yes.
All right. So I just wanted to ask one more question in regards to fertility and pregnancy in women.
Okay.
Does or can thyroidism or thyroid affect fertility and pregnancy in women?
Absolutely. The effect of thyroid, so the hypothyroidism, for example, if somebody has a problem with where the thyroid is doing less or sluggish, they will not metabolize. They can be losing their hair. They can be having dry skin, brittle hair, nails, fatigue. They will not digest their food properly. They can be gaining weight, and if they already gain weight, they will not be able to lose weight the rate they want to, even though they're eating right now and they're exercising. So all those things. And if they have hyper, they can be losing weight uncontrollably, and they can be having palpitation, their heart beating too fast. So in regards to pregnancy, if you're not getting enough food, so it depends on which side you are. Is it working too much, or is it working too slow? So either way can still affect it to be more pronounced in pregnancy. That means to be worsened in pregnancy. And the medications that you take can also transfer to the baby depending on if it's hereditary, if it's autoimmune. So it's a lot of things that will happen with thyroid during pregnancy. So,
well, thank you for tuning in. This has been another episode in week 2 of our Women's Wellness Challenge. If this is your first time tuning in, again, my name is David, and this is
Dr. Feyi.
And thank you for watching. So we hope to see you soon tomorrow for another episode of our Women's Wellness Challenge, and we will see you soon. Thank you. Have a good day.